Whether at your local green market, corner grocery store, or neighborhood restaurant, you're supporting your community when you buy local.
Food grown right here by Florida farmers doesn't need to be shipped as far.
That saves fuel and cuts emissions.
Buying local is more than just supporting area businesses and growers.
It's buying fresh, wholesome, and delicious food for your family.
Products you trust from people you trust.
Fresh from Florida.
Good for the environment.
Good for the economy.
Good for you.
Hi, I'm Greg Peterson of the Peterson Farm Brothers. If you've seen our videos, you know we're proud to be farmers. Farming can be dangerous. Never assume location or depth of underground utilities or pipelines. Before you start any work on your farm, call 811 or visit clickbeforeyoudig.com to have underground lines located. It only takes a minute and can save your life.
Never assume the location or depth of underground lines. Always call 811 or visit clickbeforeyoudig.com before you start work. A message from the Pipeline Operators for Ag Safety campaign.
When growing asparagus, there are a number of common diseases to watch for. Rust is one of them and presents several symptoms depending on the season. The easiest way to prevent rust is to cut back the ferns as they die over the winter and dispose of the infected pieces. Crown rot is another disease that's hard to prevent and get rid of. It can live in soil for a long period, spreading through infected air, soil, and seeds. Asparagus is also prone to purple spot disease during particularly wet or windy weather. The good news is that the spots don't affect the taste or texture of your asparagus spears, and they often disappear entirely during cooking. Gray mold is most common in wet, humid conditions and in soils with a low pH. Standing water harbors spores and makes it possible for the disease to live a long time in the soil. When it comes to preventing and treating asparagus diseases, it's important to act early and often. I'm Kathy Isom, Southeast AgNet.
Today will be sunny with a high of 78 to 80. Clear skies tonight, low 52 to 57. Then Tuesday, Wednesday, and Thursday all will be sunny to partly cloudy and pleasant. High Tuesday, 81 to 83. High Wednesday, 83 to 86. High Thursday, 87 to 90. From the Florida Weather Center, I'm Holly Holdren.
And welcome back to Ocala Talks. Big Joe here sitting in for Tom Schmitz. As soon as his back gets back, he might be back. Welcome. We've got an outstanding interview coming up right now. Alberto. I love that first name, Alberto. He sounds so rich, so exotic. Alberto, how are you this morning, sir?
I'm doing well. How are you doing?
I am doing fine. It's Monday. We made it through the weekend. Now, it tells me here that you are a senior strategist for the Health Policy Project. I'll leave that dangling right there so everybody goes, say what? And I'll just give a little. They got quite a bit on you. I could read this and take up the whole 10 minutes. I'm not going to do that because you've got so much to tell and so much to dig in. My notes just go on and on and on. How long have you been doing this, what you're doing?
So I've been with Unidos US for the past 2.5 years, but I've been working in healthcare advocacy for more than a decade now. So really trying to ensure that every member of our community gets the coverage that they need, especially at this time.
I knew you were working more than 2.5 years. That's for sure. Your dossier here is quite extensive, and of course you're bilingual, and you work with everyone here. And I've got the suggested interview questions for you. Medicaid and CHIP. And now I've heard of Medicaid, but I've never heard of CHIP. What are they, please?
Yeah, so Medicaid, it's the nation's largest public health insurance program, and CHIP is a children's health insurance program. So CHIP is for kids.
Yeah. So simple. But if you don't know, you don't know, right? Yeah. All right. That was a quick answer. Yeah. Now,
and I'll just
go.
I'll just mention that these programs are important lifelines for millions of Americans, including Latinos, and they play a particularly important role during these tough times. So Medicaid and CHIP, they're low-cost, free health insurance programs that can help you or you and your family get the care that you need at this time and avoid large medical bills. So it's an affordable coverage option for those who may be unable to afford health coverage through the federal marketplace or who don't have coverage through their employer at this time. So it's very important that we take advantage of this option.
Well, it says here there's more than half, or 55% of national Latino children get their coverage through this. So how has the Medicare and CHIP impact the Latino community? There you go.
Yeah, so more than 70 million Americans receive health coverage through Medicaid, including 18 million Latinos. And as you mentioned, this is an important program for Latino children. And in Florida specifically, about half of the Latino children in Florida are covered by Medicaid or CHIP. But one thing that's important to note is that there's still many children out there that remain uninsured in states like Florida. So we're encouraging, as we recognize that April is Minority Health Month and Medicaid Awareness Month, we want to encourage members of their community to apply for Medicaid. You can apply anytime. It's available for many who may have had some changes in their monthly income or had some major life changes due to COVID. So it's an available coverage option for those, and for those who may think that health coverage isn't affordable. But if you apply for Medicaid, you may not be able to pay anything, and so it's an important program for many in the community who have been impacted by COVID at this time.
Okay, so you chipped at it over there, but what is covered, number one, and who is eligible for these programs, number two? You kind of chipped at it, but can you get in a little more detail?
Absolutely. So Medicaid provides comprehensive health coverage and covers doctor visits, hospital visits, prescription drugs, immunizations, mental health care, and treatment for pre-existing conditions. And Medicaid eligibility is based primarily on you and your family's current circumstance. So if you have children, are pregnant, are working in a low-wage job, or have a disability, you may be eligible to enroll in Medicaid or the Children's Health Insurance Program. And in Florida, children in a family of 3 can qualify for Medicaid for children if their monthly income of the household is at or below $2,400 a month. And Medicaid is an important program for the Latino community, as I mentioned. And actually, Florida is one of 11 states nationwide that covers lawfully present children without a 5-year waiting period. So it ensures that all children in Florida are able to get the healthcare services that they need at such a critical moment in their lives.
Well, when I said I chipped it away, you put all the pieces together. That was no wonder you've been doing it so long. Yeah, it shows, Alberto, it shows. Why is it so important for children to have the health care, which is almost obvious? And the second part is, why should families enroll now? Because you said it could be any time, so there's 2 more for you.
Yeah, absolutely. So the pandemic has reinforced the importance of quality, affordable, accessible health coverage to live a healthy life, especially during this public health crisis. And so applying for health coverage under Medicaid or CHIP today gives you peace of mind, knowing that you and your family are covered. So we know that there's so much happening right now, but applying for Medicaid, applying for CHIP, it gives you and your family peace of mind knowing that you're covered. And we know that right now there's a lot of people that remain uninsured. In Florida, for example, Latino children, before COVID, were almost 1.5 times as likely to be uninsured than other children in the state. So that's why we're encouraging members of the community to seek out this coverage option. And if the cost of health insurance feels out of reach for many of you during this time, just know that you may be eligible to apply for affordable health coverage under Medicaid or CHIP.
Okay. So when you said to find out how they're going to be eligible, that gives me the next question, and it's perfect. You're saying, well, if they're going to be eligible, how do they enroll? Where do they turn to say, okay, I think we're eligible because we fall under the guidelines, how much we make a month or a week. So how do we put our name in the list, our name in a hat, and say, okay, can you help us?
Yeah, so you could visit myflorida.com/accessflorida, or you could call 1-850-300-4323 to see if you may be eligible to apply.
All right,
We'd also encourage listeners Oh, yes, go ahead.
I
can repeat that again.
Yeah, repeat it slowly because our listeners are used to carrying a pen and pencil or with them when someone comes on like yourself. So I just need you to slow that down. You know it by heart. They don't. Say the numbers again, please.
Yes, so it's 1-850-300-4323.
See, I had written that down and I followed you. Okay, 4323. Excellent. Okay. Sorry for the interruption, but I want to get that information out there right, Thank you.
Yeah, no problem. And I also encourage listeners to visit our website. That's unidosus.org, where we have information about Medicaid and other healthcare coverage options that are available to the community in both English and in Spanish.
See, we have a lot of time left. We've got about 3 more minutes on the interview, but I'd rather do it now than sound like a machine gun at the end trying to squeeze it in because we're running out of time. Makes sense a little bit,
Yeah.
Now, once in a while I do that, once in a while. Is there an enrollment period for these programs? Or is it any time?
You can apply any time. So we recognize that life changes, and as life changes, you may be eligible for coverage under Medicaid or CHIP. And so I want to emphasize that Medicaid can be a temporary option for you as you search for a new job, or if you're in between jobs, or just need some temporary assistance to help you and your family, get by. So again, I encourage folks to visit myflorida.com/accessflorida. Call 1-850-300-4323 to see if you may be eligible to apply for Medicaid. Even if you've applied previously and got denied, you may be eligible again given your current circumstance. I want to really emphasize that encouraging folks to apply again and see if they are eligible for this program.
So when you apply and you say, listen, I've just lost my job or I'm in between jobs because of... This is not a full-time, all-the-time thing. It could be just a stopgap because when you go to your new employer, they might have benefits that you work with. Then you can say, okay, and then you just turn to them and say, I don't need you anymore, but thank you for the handout. I mean the hand up. That's better, the hand up. Correct?
Yes, that's correct.
Okay.
That's correct.
Now, we're in Florida. We're talking about Florida, but we stream this out with YouTube, and everybody can hear us and all this. The eligibility varies by state and is dependent on household size, monthly income, and family circumstances. But you're accompanying all of this right now for Florida. But no matter where your family is, it can be availed to them, the program. Correct?
That's correct. Especially during this pandemic, we know that monthly your job situation might have changed, your monthly income status might have changed, and because of that, you might be eligible for Medicaid this time around. And so, and we know, for those who are newly pregnant, the Medicaid serves as another important resource for health coverage during this critical time. And I should mention that, regarding children, making sure that children are covered by Medicaid, there are some positive long-term impacts that come with having kids covered down the road in terms of educational attainments, being able to contribute to the economy. So that's, there's a lot of research showing the importance of having, newly pregnant mothers and children covered by Medicaid and what that means for the future of your community.
Fantastic. You hit every point. You must have done this a few times. Put a zero behind that. If you would, just slap me the website one more time, and then we're going to call it a day.
Yeah, so it's myflorida.com/accessflorida. And the number is 1-850-300-4323.
And what is the other one? It's a .org. Which one is that now?
Yes, you can visit our website. That's unidosus.org.
Okay. Alberto, thank you so much. I enjoy the heck out of this. Every day I interview someone new and I get more smarter. How's that? For lack of words. Thank you so much for taking the time.
Thank you so much.
Sun and Fun's Aerospace Expo is back and better than ever from April 13th through the 18th. It's not just an air show, it's everything aviation in 2020.